Healthcare professionals. What is a telltale sign a patient has used drugs heavily in their life? Talc retinopathy. Tiny talc particles accumulate in the retinal blood vessels of IV drug users and can be seen during a routine eye exam. Why is that? Is it something that was introduced to the body when they use needles or something? Not a doctor or scientist, just curious. Binding agent in tablets. From people crushing up pills to inject. The talc can't go anywhere and is deposited in your tiny blood vessels all over your body, but it's easiest to see in the back of the eye. I remember doing phlebotomy rotations at a hospital in the middle of nowhere, Tennessee. Aside from the small 60-bed hospital, there was nothing but farmland for miles. I met a patient with heavily scarred, twisted veins. I failed to hit a couple times but eventually found a viable one. IV users can be tough sticks, but what makes me remember him to this day is the forlorn look in his eyes when he softly asked me to be careful because it was his last good one, so please don't blow it. Scar tissue generally doesn't go away on its own. How many spots are there and how often can a spot be used? Just curious, since I've had a needle over 100 times in the same spot. It does scar and doesn't heal as quickly anymore, but otherwise it's still usable. It varies a lot because IV drug users aren't usually using good practices for their drugs. Digging around, accidentally going through the vein, pulling out and retrying, etc. I saw a guy blow a vein out on his first try with a huge shot of meth, and I was able to use the same vein like 50 times in a row when I was actively using. Not to mention dull needles, old needles, etc. There's a picture floating around of a close-up of used needle versus new one. Huge difference at the microscopic level. Truth is, if addicts were to use clean new needles and were really good about rotating sites, they could inject for quite a while with no issues. I was 16 and had a doctor got angry at my deviated septum, said there was a hole burned through. He asked me how much I've insufflated drugs and I told him the truth, never. He treated me like shit even though at that point I'd never snorted anything. Only years later did I develop an appreciation for the booger sugar. Later, I found out the nasal spray I used growing up had a side effect of burning out nasal tissue. Do you remember which nasal spray that was? 60-year-old man who had done some drugs in life but was a heavy alcoholic. Never tells DRs of his past. Quit all by age 50. Health is falling apart by age 60. Doctor does an MRI and showing him pictures explaining the results. She turned to him and asked if he had drank heavy for years. He glares at me thinking I tattled. No. Doctor shows him the extra space in his skull around his brain. Explaining his brain had shrunk from alcohol abuse. I guess you can lie about it, but can't hide it. After a blood draw I was asked if I was a heavy drinker. I absolutely was, but had my shit wired pretty tight at the time, so I asked how they knew. Guy looked me dead in the eyes and says, "Your red blood cells are the size of damn dinner plates." I was curious too, so I poked around through the literature. It seems that alcohol abuse often leads to vitamin B12 and folate deficiency, which cause macrocytosis, large RBCs. I'm at work so I couldn't spend that much time looking into it, so if someone else knows better, MK. Yep. When alcoholics come in we start them immediately on B1 and folate and usually B12. Some deficiencies are so bad they already have Wernicke's. That Wernicke guy really got around. Till it's actually the same guy Wernicke's area, aphasia, is named after, as well as Wernicke-Korsakoff. We took one to the hospital not long ago who was nearly not breathing when we showed up. Young patient. Hit them with Narcan. Breathing improves so we can stop bagging them. They are conscious by the time we get to the hospital. What did you take? Equals. I didn't take anything. The Narcan worked. There's only one reason Narcan works. Turns out they took some narcotics. We were so surprised. He was smacking his mouth like a fish out of water, wearing a leather jacket in the middle of a hot Texas July. Admitted to coming down after smoking meth. That first sentence is like the beginning to a Western crime novel. He was smacking his mouth like a fish out of water, wearing a leather jacket in the middle of a hot Texas July. He didn't offer his name, and I knew better than to ask. I watched as he paced back and forth in front of my desk, regaling me with some cockamamie story of how he didn't deserve this. He was a good guy, was only trying to make some extra scratch to take care of his family. I've heard it 1,000 times before. It starts with a few drinks with friends after work, maybe betting on the ponies once a month, and it turns into a desperate man creaking my floorboards and saying that there was a note left in his kid's empty bed. It's never his fault. He just got in over his head, you see. He got caught up in the rush and bet more than he could pay. There's no way this one was a loser. He was confident. Well, when that confidence faded, they always found their way to me, begging for help. When you give them 6 milligrams of Versed and 300 mcg of fentanyl and they are still talking to you like normal. I've had to cancel a procedure because of this. Got to 5 and 400 and they were still wide awake and could feel everything. Nursing and myself were uncomfortable at those doses and had them reschedule with anesthesia. Yeah, we have a lot of opioid abuse where I was sedating. I used diphenhydramine to potentiate and we also used Brevital, thank God. Without the Brevital it would have been a nightmare. I'm not a full ginger, brown hair, red beard, but both my parents are. I'm also 6 feet 4 inches 265 with a high metabolism. I've had multiple procedures under general anesthetic, and every time in recovery, the doctor mentions how quickly I can shake off the anesthesia. My middle kid is just like this. Started to wake up in the middle of a procedure I was allowed to watch, and the anesthesiologist turned to me and said, "They're not a lightweight, are they? Most medications that cause drowsiness barely affect me, except Benadryl. I'm convinced that shit can fell an elephant." Oh yeah, DPH makes RLS so much worse. I don't envy you for having to deal with that. When I was in active opiate accusation, that was one of the only withdrawal symptoms that I couldn't deal with, and honestly why I got on MAT eventually, medication-assisted treatment. Just couldn't handle the sleepless nights with RLS, well, restless body really, but mostly the legs. Dunno if you've looked into different medications for it, but I know there are a few out there. If you feel like it's a net negative on your life. I had a bowel obstruction caused by diverticulitis last week, was brought to the ER at a pain level 10. They gave me fentanyl for the pain and holy fuck does that work. 4 years ago when I was first diagnosed and at a pain level 8 they gave me morphine. That dropped it to a 4. I didn't realize how powerful fentanyl is other than the news horror stories and how much it really helps. Got fentanyl in the ambulance after getting shocked through my faucet by lightning. It didn't touch the muscle pain in my leg, not one bit. The EMT looked a little spooked by that. Morphine didn't touch it either, but it made it so I didn't give a shit anymore. -100 do not recommend washing dishes in a thunderstorm. Answers to FAQs. I was washing a metal pet bowl. It felt like my bones were lit on fire for a quarter of a second. If it had gone on any longer I would have rather died. Pain lasted over 3 weeks and now it'll occasionally spasm. You use your calf more than you think. I spent overnight in the hospital because they couldn't figure out why my leg hurt so badly. The electricity entered my hands, exited my calf. I was conscious the whole time. Yes, I am now afraid of thunderstorms and it sucks because I love mountain camping. Total bill, $122,000. My portion after insurance, $3,000. And most importantly, it is exceedingly rare. About 20 people worldwide get shocked by lightning yearly, edit. Through the faucet specifically, about 1 dies. Very very low chances. But ya know, maybe just don't shower or do dishes in a thunderstorm anyway. I had a reconstructive jaw surgery years ago, and when I woke up they were giving me doses of fentanyl every 30 minutes hour, and holy shit, that is the best drug I've ever taken. I was laughing and joking with the nurses and kept yelling down the hall, "Hey, I need more of that street killer," which they thankfully found hilarious, all immediately after waking up from having the bones in my face cut apart and rearranged. I'd never ever seek it out, don't need addictions or death, but I certainly wouldn't oppose it if ever offered again at a hospital. I can see why people get hooked, it's almost frightening enjoyable. I have a colonoscopy once a year, today is my lucky day actually. They give me fentanyl for that and you were right. It is scary how nice that high is. I got IV fentanyl in the hospital when they sent me home after a surgery and was astounded. They gave me a script for Oxy, and I wish I never filled it because I didn't ever use it because I was too scared. Ibuprofen was enough to keep me comfortable. I was an army medic, and when I offer to hit my own veins I always have to follow up with that. I don't look a drugs user, but sometimes you can be surprised. I mean, after watching the corpsmen in the Navy miss my veins several thousand times, I'm pretty sure I have more training than they do at this point. It's crazy how the people you expect to be good, aren't. Different, but similar. My girlfriend is a pharmacy tech. She gave a woman a vaccine flu, and was told she was the first person to not make it hurt, at least not more than it should. The girl had a tattoo, and she indicated she usually gets the shot in the animal's eye toward the front of her shoulder, and my girlfriend picked a different part of the animal that matched where training said to do it, side, slightly back of the arm. My girlfriend said to me that she was shocked because the eye was too far forward and in a no-go zone. The other people who'd given this lady shots in the bird's eye were the licensed pharmacist and the Tech 4. My girlfriend is only a Tech 2 going for 3. Honestly, some nurses and doctors are absolutely garbage at giving shots or drawing blood when they have to deal with tattoos. I have 2 full sleeves, both neotrad and very colorful, sure, but I also have extremely prominent veins, to the point where I can manually move some of them if I want. You'd think that wouldn't be an issue, but no, immediate tattoo panic. Where does needle go ASDFGJL? I dunno. Have you tried the massive bulging vein that every single nurse absolutely loved before I got tattooed? Even I could do it, and I've never touched a needle in my life. FFS lol. I worked at a veterinary office and I have indeed set my own fours before. I've joked that, once you set an IV on a dehydrated, screaming, clawing cat, you can set an IV on anything. And they leave me alone. Plus, I've got tubes for veins. Literal superhighways for blood and IVs, but I've so many people blow them that I give them one try and then I ask for someone else. But yes, I've gotten some weird looks when I offer to put in my own IV. It's damn hard to get an IV in them in our usual go to places due to scarring of the veins. They usually tell us where we have to go because that's the only place that still works. I lived with a med student who came home one day and told us about the necrotic penis she'd seen that morning from a user who had collapsed every vein he could find and had resorted to the last one. Had a guy come to talk to us in high school about the danger of drugs. Spent an hour telling us how awesome drugs were. Finally someone asked him if they were so good, why did he stop? He said he'd collapsed every vein and all that was left was his penis or eyes and didn't fancy either option, so he went and got help to get clean. That was the most effective part of the presentation. The best advice I got from anyone was drugs make feeling normal boring. You enjoy everything so much more on dope, that you can't enjoy the things you like as much when you are sober. I always found it really stark that Amy Winehouse said this the night she won a Grammy presented to her by Tony Bennett. Tony was her lifelong hero. She won a Grammy. She performed that night too. She leaned over to a friend and said something along the lines of, "God, this is so boring without drugs." Arguably best night of her life but couldn't even enjoy. So sad. This is really interesting to me. I'm not a drug addict. I was a functional alcoholic before I got properly medicated for my ADHD, but I feel this way, too. Nothing is all that enjoyable. Things that could be enjoyable are either incredibly nerve-wracking or just boring. I don't know if that's because of my PTSD, my depression, or the ADHD, all of which I've been diagnosed with formally, but it's interesting that is what happens to drug addicts. My money is on the ADHD because I have friends with all those disorders, and the things we have in common become evident, and an inability to enjoy things is the big one with ADHD. I wonder if drugs allow people with this kind of depressive inability to enjoy things to enjoy them. To feel joy the way everyone else seems to. And I wonder how much of drug addiction is people just seeking that feeling out, and being unable to stop once they know what it's like to be happy. Essentially, I'm wondering how often the cause and effect go the other way, with the inability to enjoy causing the addiction and not the other way around. I know that when I'm buzzed, just before I start to feel sick, I'm calm. Things don't hurt. I don't hate myself. I don't feel like everyone who is looking at me hates me and wants me to die. I feel kind of happy. Things are sort of fun. It breaks my heart to think that for most people, if they're among friends or engaged in a nice hobby, that's how they feel. Just out there feeling is their base minimum. The best I ever felt. The best advice I've ever received was a kid in my class asking me if I've ever tried heroin. As a senior in high school, I had not, thankfully, to which he replied simply, "Please don't ever try it, agreeable yellow." I did, and now I can't stop. He had the saddest look in his eyes. I will never forget it. That was as much a reason as any right there to stay away from it for good. I remember being prescribed Oxy. My parents always said they were ineffective and felt bad. I was in so much pain after my operation that I took some, again, as prescribed, and I remember sitting on the toilet bleeding out of orifices the surgery caused, that not the Oxy, and telling my wife it felt like I was being sucked off by an angel. After it wore off, I took the rest of the bottle to one of those pharmacy thingies. Most won't take opioids actually, but this one would, to surrender drugs. It was too good. Over a year later I had a new doctor. He was going through my med list asking about refills. He just rattled off every one, and in there was the Oxy, and I paused for a second. And I asked, "I can get a refill?" And he said, "Sure, absolutely." And I said, No, I have no need. Thank you." But wow, was it tempting. One time Redditors. One time, and I had those thoughts. This was me with IV dilaudid after a motorcycle wreck 11 years ago. I now have a stupidly good life as mountaineer and backcountry snowboarder with a great family and all my needs met, but I often find myself still thinking about the way it made me feel, and in the back of my head just kinda wish I could live in a hospital bed hooked up to an IV with that shit in me all day. Nothing feels as good as drugs, and that's kinda scary. My dad used to get so fired up about this, and as a kid I didn't get it. But now I understand his point that when you tell kids weed is terrible and it'll ruin your life, and then it doesn't, it'll make you question whether or not the other stuff is really that bad. My mom was like, but she wasn't a drug user. Just very sick and constantly in and out of the hospital. There was one night they were discussing having to do an IV in her foot, skeptical smiley face. Luckily though, there was a goth-looking guy who just started as a phlebotomist and had an IV going in less than 5 minutes. He did in 5 minutes what 2 nurses and a doctor couldn't in an hour. Oh man, the fucking Batcave. I used to belong to a subculture-focused message board when I was a teen, and the Batcave sounded so cool to me. You might be right about most goth clubs having a chainmail muscle shirt guy. This was up in Canada, in Winnipeg. I had a patient once refuse the contrast dye injection as part of an MRI scan because you don't know what's in that stuff. They were there because they were having palpitations following cocaine use. Man, getting that dye injection. I remember the nurse telling me it was gonna feel like I'm peeing, but I'm not. I remember going, okay, yeah, I won't think I'm peeing. That dye went in and immediately I was like, oh shoot, I'm taking wait a minute. Yes, I just had a quart with dye, and despite already being off my tits on morphine and fentanyl they gave me, that was such a weird feeling. This type of thing never fails to amaze me. I know someone who has breast implants that are outlawed in our state, gets Botox and lip injections on the reg, just started taking Ozempic and does blow weekly. She never got the COVID vaccine though because she was concerned about unknown side effects. Worked at a clinic that subsidized the treatments for many drug addicts, physical therapy. My biggest tell was if they were current, their eyes and personality was drastically different, but for those who had years of previous use their pain thresholds were very low. They were so used to dampening down their nervous system that any stimulus afterwards felt like it was aggressive or too much. To use an example, imagine wearing sunglasses 24/7, in the house and outside all the time. Now picture after years of that trying to navigate the world without sunglasses, all of a sudden light sensitivity will be through the roof. It works similar with pain thresholds in my clinical experience. This is obviously outside of various physical signs like collapsed veins, trace marks, etc. You can tell by the way that they are. The surprising ones are the closeted grandpas. I worked in the cath lab and an older lady's cath was negative and the doctor told her, "Then what caused me to have chest pain?" "Probably your habit, ma'am." "What do you mean?" "The heroin." "Oh, really?" She looked like your average quilting champion. It's usually in their charts, but if it's not, Hep C, liver failure, pancreatitis and overall health status and appearance for their age is usually a good giveaway. 10 out of 10 pain score, every time you ask. Some erratic behavior is common too. I see a lot of CKD and diabetes in chronic users or patients in recovery after a lifetime of substance abuse. I come from an area with a lot of heroin, coke and alcohol abuse. I've rarely ever had a meth addict and rarely crack users, so this applies mainly to those drugs. I kinda hate the pain score questions. People will always answer differently. I suffer from cluster headaches, and when the doc said how had is the pain, and I said an attack can be between 0.6 to 10 out of 10 depending on the attack. And they didn't take it seriously. I then said that when I broke both the bones in my leg and had to walk on it, I only felt like that pain was a 5 or 6 out of 10. At that point they started taking what I said a lot more seriously. When I had my C-section and needed pain medicine, they asked me to rate my pain, keeping in mind that I had been through 36 hours of the worst pain of my life off and on just prior to that. So I told them it was like a 4 to 5 when I was just sitting, but a 7 to 8 when I moved. The nurses flat out told me, it has to be a constant 7 or higher or you just get Tylenol, so do you want to try answering that again? They had to tell their patients to lie just to get them medication they really did need, and then wonder why people come to the calling everything a 9 or 10. Substance abuse treatment nurse here. There are the obvious signs to when someone has or is using, but I personally think about 80% of heavy drug users look like everyday normal people. These people wouldn't turn my head at the store or out on the streets. These people have jobs, have families, have lives outside of drug use. A lot of them have emotional and mental challenges that surpass any physical sign of drug use.